Welcome to the Flex Forward podcast, where grit meets growth. With your host, Nic Espanet, bringing you stories of resilience, reinvention, and the real climb to success.
All right, everyone, welcome to the Flex Forward podcast. Today, we're joined by Chris Moose. Chris is the VP of Life Science and Data at Will. Chris, welcome to Flex Forward podcast. Glad to have you. Can't wait to hear more about what you do. Can you tell our listeners a little bit about you and about what you do at Will?
Absolutely, and thank you for having me here today. I'm excited to talk a little bit about my journey and then also what I do at Wheel. Let's start first with what is Wheel. It's virtual telehealth infrastructure. So let's unpack that for a second. A lot of the leading organizations across the nation, if they want to have a healthcare option, don't want to build out the technology and also the clinical network underpinning what it takes to run a nationwide healthcare capability. And we allow people to offer those services and to then white label it. So you can go to company A, have a healthcare experience, and it's actually our technology and clinicians behind the scenes supporting it. That's what Wheel does. Prior to that, I was part of IBM's consulting organization where I was a partner in the healthcare and life sciences practice, where I focused a lot on what's going on within pharmaceutical supply chains. And so I thought a lot about access to medication. And then I wanted to join Wheel because that gave me the opportunity to explore what does it mean to have access to the actual healthcare encounter. So that's kind of the bookends of those two parts of my career.
Very interesting. Well, that's neat. You think about I've heard of white labeling of different products, but not healthcare like that. And just something that popped in my head while you're talking about is, do you, with clinicians that are virtual, do they have to be licensed in the state where the person's sitting, or how does that? Just, I don't even know if that is something that you're aware of, but that kind of popped in my head. Like, how can you do it nationwide? Because I've always thought we need some kind of nationwide licensing to help clinicians be able to treat people anywhere. Since we can do virtual now, you shouldn't necessarily have to be in the same state for a doctor or a nurse or physical therapist or whatever to do a virtual call with you. I guess maybe the state wants to have the licensing and some of that stuff to match up, but how do y'all handle that stuff cross state?
No, it's that's exactly the challenge that we face. So think about the challenge that another marketplace like Uber faces within a city. You've got people that are in a certain location, they want to go somewhere, they want to have a certain type of a ride, they want to do it now, they want to schedule at some point in the future. These are all variables, and you have to match all that together to create that moment of a vehicle, a passenger, and a driver all coming together in unison. Now, think about how hard that is to do on a city and expand that to the nation. The analogy then being, okay, well, we have a patient, they're somewhere, they have a certain reason why they want to have a healthcare encounter. And then you got to match that with a clinician that's got the ability to practice in that state, that's the right person to take on that encounter. And it's actually one step even harder because then we're predicting what the price is going to be for that encounter before it actually starts. So we then also have to think about matching the licensure level to the best possible point so that we can give the lowest price possible healthcare encounter. So those are all the variables that go into it. It's a very interesting marketplace matching problem. To your other point about practicing across state lines and whatnot, that was one of the things that was really interesting during COVID, were some of the relaxing of different regulations and trying to encourage the movement of clinicians. And how long could you practice in another state before you need to be licensed by that state, as we looked at some of the healthcare shortages. So just in general, the challenge of clinical expertise, availability in the regions where it needed continues to be a fascinating challenge.
Yeah, I was I guess I'm still a physical therapist, but before I got into commercial real estate, and we looked at doing travel, I was going to do it, but with my family, travel PT, but just getting the license to go. I was looking to work in Montana, and just getting the license set up, and it was like, wow, this shouldn't be that hard. I'm licensed in Texas. It should be able to show that I have a little proficiency and be able to, and I think it's gotten, that was over 20 years ago, so I'm sure it's gotten quite a bit easier, but back then, you didn't have a lot of internet stuff to search on, so trying to figure that out was was a big hurdle to do it. And so it's neat to see that you guys are helping work through that and serving patients with, helping bring it to them. Cause I think that'll bring down costs too. Cause if you have access to doctors just in your state versus, or all the states, I think there'll be, it'll help with it'll increase the supply of doctors that are clinicians that can serve you and help drive prices some too, I would think.
Yeah, I mean, it's interesting. One of the things that happens is you've got the regionalized variability of healthcare costs. If you have a provider and it's a in-person encounter, then that provider's pricing is going to start to mirror whatever the cost of living, somewhat adjusted for healthcare within that region is. But when you then break that down and you say, okay, but if you could have a provider that's anywhere in the nation, because you could have a provider that's living in Maine but has a license in another state, and that provider now has a certain price that it costs to get them to participate in the healthcare ecosystem, you start to create this nationwide pricing versus the regionalized abnormalities. And I believe that starts to create a downward force. And because a lot of what we do is on a cash basis, you start to remove some of that complexity of, well, what is my insurance? Is this above or below my deductible? How am I going to pay for this? When you can present a very clear cash price at the beginning of the encounter, you take what is very confusing, you make it very understandable. It becomes like another consumer transaction.
And that's awesome. We've been in a cash pay healthcare system is not insurance. It's like a cost share, but for almost a decade. And it's gotten easier, but I love it because at one point we'd call and say, hey, and we need X, Y, and Z. What's the cost? Well, we don't know until you come in. I'm like, what other product? I'm not going to drop my car off and say, do this, and then tell me the price. You're going to drop a car off, give me a ballpark if something changes. But 10 years ago, the doctor's office just couldn't get their brain around giving us a price on the front end. I'm like, one, it should be cheaper because I'm going to pay you when I walk out of the place. You're not going to have to beat on an insurance door or phone for months. So yeah, it's definitely improved, but it's been an interesting transition or growth through the industry. So very neat. So out in that, I'm sure there's a lot of, maybe not a lot, but quite a few, there's some competition and people trying to do, or companies do the same thing. What is something you feel sets you and your group apart?
I think one of the things that really matters is what you don't do. And there's a lot of organizations out there that maybe would go into the compounding space or a couple other therapeutic classes that were a bit of a moment in time, but weren't really where healthcare was going to go long term. And so, I mean, let's unpack that for a second. If you were perhaps compounding a weight loss medication, you're doing it with the understanding that there was a shortage of weight loss medication or something else that was causing it to be in a situation where compounders were allowed. But it was very obvious that if you play that out over time, given the market opportunity within the GLP-1 space, that branded pharmaceutical products were going to increase their capacity, and that moment of there's a shortage, therefore there's an opportunity for compounding was going to go away. So really kind of looking at the long game and thinking about where do you want to be long term and what do you want to be known for are really important ethical decisions and brand placement strategy type decisions that I think differentiate a company that's in this for the long term versus someone that's in it for, well, what can I do in the next 6 to 12 months?
No, that's a great way to look at a lot of things in life or business, is looking what your longevity is and seeing that good stuff. So what's something that you've come along your journey that maybe you found easier that others find challenging?
What we found easier and others found challenging. I think the courage to say no to certain deals, and I don't just mean that in the context of my current employer. I mean that in the context of everywhere I worked. I was really proud of some of the decisions that we made as IBM on projects that we would or wouldn't do. Same with Wheel, clients that maybe we would or wouldn't take on. So I think that willingness to say my reputation and the organization's reputation matters is something that sets us apart is very important.
I've heard that in different settings, that No, that's one of the most important words you can learn. Just, feel it. I've had to have that conversation with a couple of my daughters that like to do everything. I'm like, girls, eventually got to say no because you're getting spread way too thin, and being able to, and it's okay to say no. I mean, in multiple reasons, but even just for events and stuff, or
Mhm.
babysitting, just saying no, and it's hard sometimes when you want to make people happy, but you got to do it. So along your journey, have you come across something that you can share? Maybe you've read or heard or listened to, that a tip or a trick that you can share with the listeners that you like, that maybe has helped you?
I think the philosophy from Amazon about one way doors, and is a decision a binary, or is it a decision you can walk back, and how that factors into what you do or don't do. I think back to very early in my career, there was a technology that I was um, fairly convinced would be a material one, but it was still very early in its evolution. And there were other incumbents that I wasn't as bullish on, but were the market leaders at that point in time. And I looked at that and thought about, well, what do I want to do? Do I want to go focus my energy on the incumbents that probably are going to go away? Or do I want to go spend a lot of energy on this new one and make the bet that it's going to rise? And the reason that was an easy decision to make, of go bet on the new one, is there was nothing preventing me from going back to the old technologies. If I was wrong,
They're
I could
still
just
around.
go back. So, thinking about the world in that context of what are the decisions that have to be right versus what's the decision that has an option to reverse itself, and then don't spend too long. Just make a decision and go forward.
That's don't have the analysis paralysis is a good way to put it. Great stuff. Well, what is one of the biggest challenges you've had to overcome in your journey?
I think definitely time management. Uh, have a family, have a couple sons, and wife, and would always be lovely to spend more time with them. But you have to balance that with the opportunities of work, and how do you find the right mixture of being there for them, but then also executing on the opportunities that are in front of me in the work context to get to where I want to be there. So that balance, I don't think anyone nails it. I think everyone suffers from it, and each of us kind of has to figure it out on their own. The real challenge is that um, your kids are they're a certain age for just a day, then the next day they're a day older.
We have 18 summers, right?
Moments,
Yeah.
yeah, exactly. So, and you only get one shot at it. So it's not as if you can look back and say, "Oh, well, this would have been the right way to have played that scenario." That scenario is past. That's one of the crazy things about life is we go one direction and you learn, and hopefully you make better decisions in the future, but
Mhm.
you can't go back and undo something.
No, for sure. I've got a daughter that's going to be a junior in college, one that's leaving for a freshman year, and you're like, where'd it go? So when I talk to other dads, I'm like, hey, it's cliche. I heard it. I didn't listen, but really soak it in. We had a thing at church in childcare at one time. It was, and I don't remember the exact set. It was like 3 jars with marbles in it. And it's like, this is how many Sundays you have with a first grader. This is how many you have with a sixth grader. And this is how many you have with a ninth grader. And it's a good, just a visualization of how many just Sundays you had left with one of your children from, as they hit those milestones of school age. And
Yeah,
so that was kind of eye opening, like, wow, those are zipping by, and they will fly by in no time at all. Well, Chris,
they
it's
definitely do.
yeah, for sure. Sound like things are going well, and congratulations. And a lot of folks, as they start seeing more success, start thinking about maybe, because like you said, the work life balance or the time balance, you got to put your time in. They start looking at other potential investments outside, and maybe create some mailbox money. Or, have you ever thought about that? Are you involved in any type of alternative investments or anything like that that help you produce that outside income?
Nothing material. I've been fortunate to be part of some angel investments, um, but I would say that I've always looked at those as pure upside. And I think for most people, unless you really have a great connection into the community that fuels those types of investments, I would pursue the same philosophy of you've got your job and then you've got the upside, and don't confuse the two.
Yeah.
As far as the mailbox money, one of the things that I was always quite careful about was cross pollination of, if I'm working for this employer and I am generating IP or other ideas, that employer has claims on it. So I never wanted to get too close to confusing who had ownership of the ideas I was coming up with.
Sure. And I mean, sometimes it's real estate or something like having a rental house, and people, it shouldn't have any IP, intellectual property overflowing, unless you start making a smart home, a smart medical home. Then you get in trouble. Well, as for wrapping up the interview, do you have any exciting plans or initiatives in the next 6 to 12 months?
I think really looking at how healthcare has continued to become more transparent. I don't want to have this be a pro or anti administration comment. I just want to leave it out there as a very neutral. There's a lot of change that is happening right now within healthcare from a technology perspective, and a lot of drive to interoperability. So some of the challenges that patients face on their healthcare journeys of, here's my record, how do I get it somewhere else? How do I keep everyone on the same page? Those are being addressed through the CMS interoperability pledges and other technology initiatives that are underway. And I think the government really starting to put their hand on the scale and say, let's figure out how to look at cost, transparency, and just the healthcare experience is something I'm very excited about. And I'm curious to see where this continues to go.
Very neat. Yeah, that sounds exciting. Just the transparent. I think transparency brings a lot of clarity and savings, because you're not having waste or things like that. So thank you so much for your time today and sharing tips and tricks. If any of our listeners would like to learn more about what you do or connect with you, what's the best way for them to do that?
Yeah, I'd say just reach out to me on LinkedIn. That'll give everyone a better understanding of my bio. Drop me a message there. It's just Chris Moose out of Austin, Texas on LinkedIn. And I look forward to connecting with your listeners.
Awesome, Chris. Appreciate you showing up today and joining us on the Flex Forward podcast. And everyone, thank you for listening. Be sure to like and share and keep tuning back in. Thanks, Chris. Appreciate it.
Thank you.
Thanks for listening to the Flex Forward podcast. If you've got grit, growth, and a great story, visit flexforwardpodcast.com/guest to apply and join us on the show.